So, like I said, my name is Monica, and we're from the University of Arkansas School of Nursing. We just wanted to come and talk to you guys today about nutrition, exercise, make sure you get plenty of rest, and postpartum depression. So I'm actually covering the nutrition part, and what I want to talk to you guys about is like what you normally need, and then how that changes if you're breastfeeding or if you're pregnant. Is anyone here breastfeeding? You are? Okay, great. Is anyone pregnant by any chance? No? Okay. So I'll go over the basics of what you need for all of us in the room that are women. Braxton, I'm sorry. And you have it there on your handout that women need about 6 servings of grains a day, and preferably about half of those would be whole grains. And so I kind of have listed on that sheet of what a grain or what a serving is. And for grains, it can be like a slice of bread or a half a cup of rice or like 3/4 a cup of cereal. And so that's kind of what that would look like. You would want about 5 servings of vegetables, which could be a cup cooked or a half a cup of cooked vegetables, or like a big cup of lettuce or spinach, any type of those leafy greens. For fruits, about 2 servings of fruits. Just like 1 piece of fruit or 1 cup of fruit for each serving. For dairy, you would want about 2.5 servings. So, milk and all that stuff is great. A cup of milk or 3/4 cup of yogurt, 2 slices of cheese. I really like that because I can get 2. And then meats, about 2.5 to 3 for just average women. And it gives you the grams on there, so if you want to measure your food and do grams, that's great. But another good way is just your fist, like serving size or a deck of cards. So that's pretty good too. And then for breastfeeding, it's on your sheet too, but you would want to increase whole grains and vegetables and dairy. And so it's kind of on there of what you kind of need to increase. And then everyone who's pregnant or in childbearing age should make sure they're taking something with folic acid. Because there's a certain thing, like if your folic acid is low, your child can have like neurotube defects, and it occurs less often when you make sure you have the right folic acid. So if you've been taking prenatal vitamins or anything like that, it's in there. And your doctor can kind of help figure out what would be best for you, like what levels. And that's pretty much what I have as far as like specifics. Does anyone have any particular questions about? Yeah, go for it.
So we don't have dairy in our house.
Okay.
My son can't have like any milk to word it.
Mm-hmm.
So what would I do? Because like we don't have any.
Yeah, that's a great question. So can y'all do soy?
Yeah, we have like, is that pretty much the same thing? Like,
Well, you want
soy?
from what I understand, you want the good fats, especially for him for that brain development. And then you want the dairy, of course, has the calcium in it. But orange juice, fortified orange juice has really good source of calcium. Almonds, if y'all can have almonds, like
We
almond
do
milk.
almond milk.
Yeah, it has really good calcium too.
Yeah, it's all better. And I do too.
And then just good fats. So like if he can have anything, avocados, anything like that he would eat that has a lot of like really, really good fats, or even some oil, like if you could cook with like coconut oil maybe. And I can look up specific stuff for you too.
We kind of do something else.
Yeah.
How old is your son?
He turns 3 tomorrow. And he has a milk allergy, so that's fun.
You can have yogurt. It's a dairy product, but it's the enzyme in yogurt is deactivated. So the enzyme from milk in the yogurt is deactivated. So can your child have yogurt?
He throws up.
Is he allergic
okay.
to the enzyme or the protein? Do you know?
That's like they took his blood and they said he has a milk allergy.
Oh, okay.
So he has an actual allergy.
Yeah.
Okay.
I have a good cake recipe.
So if you have any allergy questions, my kid is allergic to nuts, and Molly's kids are allergic to
Yeah.
A lot of things.
A lot of things. Wide spectrum.
And shellfish, so I feel your pain.
Yes.
Guys, I'm allergic to apples. How random.
Yes.
Does anyone else have questions, like specific questions?
Is each thing listed like 1 serving or that whole
Yeah,
thing?
so like on the list, it'll say like the categories, like vegetables, if it says 5 servings, and then all the things in parentheses are what a serving would be, if that makes sense.
Okay, so like all of, like 1 slice of bread is 1 serving.
Mhm.
Okay,
Mhm.
gotcha.
And then like a half a cup of rice would be, or pasta would be like another serving.
Okay,
And I just did it like that way, kind of easier to see.
right.
So then I was gonna go over, I know like eating super healthy can be really, really expensive, and so I found this awesome cookbook that I'm super stoked about, and I printed off a copy for you girls to look at, and it's free online. was really stoked. It's called Good and Cheap, and it's like eating $4 a day per person. Has all these amazing recipes in there for soups and salads and just desserts, even breakfast. It's really cool. So I'll leave it so you guys can look at it. And then I talked to a lady. Does anyone here go to farmers market? Yeah. So I talked to this lady at farmers market, and they've been federally funded, and based on your income, like you can get a certain amount of dollars to spend at the farmers market. So, and the rule is you can get up to $25 each day. So if you went to the Fayetteville one, it's on Saturday, Tuesday, and Thursday, and you can get $25 each time. So it'd be like $75 a week of food. You can buy any produce that's there, any whole grains. You can do plants, not flowers. But you can do, like, if you wanted to grow your own garden, you can get like the strawberry plants or the different herb plants and stuff.
I think they take WIC checks too, because WIC.
Yeah, I think they do it on
Like,
on
they
the
have one that's
snaps.
like, $8 to like fruit and vegetables or however much. So you
Okay.
can take that
They give
too.
out checks for the farmers market like in May.
Really?
Yeah, she said y'all could. She said that because I was curious about it too. She said you could go, and if you had your card with you, I don't know if anyone does snaps, but if you have your card, you can go and they'll scan it, and they tell them how much you're given, and then they match that up to $25. So it seemed really cool, and so I think I'm gonna look into it, because I was pretty stoked about that. And then another resource I had for y'all, y'all probably heard of it, is myplate.gov. So you can go on there and it'll do specifically for your height and your weight and tell you like what are some good recommendations for you. So that's all I have. Do y'all have any questions for me?
Just go.
Okay, I'll let someone else go for it.
All right, I'm gonna pass these around. These are my handouts about postpartum depression. My name is Braxton Yeager. I'm from the University of Arkansas. Sorry I'm not matching in the same strokes as them. I came straight from work, so I promise I'm clean. I wash my hands. So I just wanted to give y'all some handouts with the important points highlighted for postpartum depression. So as we were just talking about, everybody here, nobody is currently carrying a child, or you're all in the postpartum period. So this is a very serious mental health issue. A lot of times it's overlooked, and there's also kind of a stigma that's attached to it, but that's something that, we really need to get past, because this is something that affects so many people. Actually, up to 15% of women experience postpartum depression within the first 3 months after delivering their child. So, I mean, it's fairly common. It can also affect not only women, but it can affect the father or the partner. So, and also another thing is that postpartum depression, it affects people of all classes, socioeconomical classes, races, and ages. So it's really important to understand the symptoms, because the key to postpartum depression is education, so that you can know when is the appropriate time to go and talk to your healthcare provider. So I'm just going to go through a few of the symptoms, and I've got them listed there on your handouts because it's really important to be able to identify them. So, obviously you think depressed mood or severe mood swings. That one, probably just come, off the top of your head when you were thinking about a possible symptom. Even difficulty bonding with your child. That's a common one. Withdrawal from family and friends. You see that in just regular clinical depression as well. And then a loss of appetite, or actually eating more than you normally do. So just a change in your normal appetite. And then insomnia, or lack of getting the proper amount of sleep, also affects a lot of people, which a lot of people deal with that. It's part of when you have a newborn, you get very little sleep. So a lot of these symptoms actually, are going to be experienced, and I want you to have in mind that, at any time you could experience these symptoms, the main key to take away is if you're experiencing them for two or more weeks, it's at that time that you should contact your healthcare provider. So, just feelings of worthlessness or shame, inadequacy, severe anxiety or panic attacks, or just overwhelming fatigue or loss of memory. So, and a lot of this stuff, like I said, can just come from not getting enough sleep, and there's actually a period in the first 2 weeks called the baby blues, And that's actually separate than postpartum depression. And generally, postpartum depression occurs after the second week, and it can happen anywhere in that first year after delivering your child. So it's really important to let your family know as well how to identify the symptoms, because a lot of times they'll be able to recognize the symptoms and know when it's time to actually intervene. Whereas if you're experiencing them, a lot of times it's hard to actually, take that step. So basically, the treatment options. So there's 3 different treatment options for postpartum depression. Your first thought that everybody thinks about is antidepressants, medications. And of course those are there. But you do need to think about the fact that if you are breastfeeding, that they are going to show up in the breast milk. All antidepressants are detected in breast milk. And if you have any questions about that, you definitely want to consult your primary care provider on that. But common antidepressants are your SSRIs, like Zoloft and Prozac. And then, also sometimes they use some other different forms of antidepressants, but those are your 2 most common that are used in the postpartum period. So the non-pharmacological interventions would include cognitive behavior therapy and psychotherapy. And a lot of times those are your first step that you're actually going to take first before you actually go to the pharmaceutical side of things. But basically cognitive behavior therapy, the goal is they want to help the mother verbalize their feelings, and even especially including those negative ones that they're experiencing. And then you and your therapist are going to sit down and develop an individualized plan so that you can focus on where to go from here. And the psychotherapy is very similar in that you're also going to sit with the therapist professional and discuss the issues and develop a plan. So basically, knowledge is power in fighting mental illness, and mental illness is a serious issue, and you just have to know that it's okay to go and ask help from your provider, and that they understand that that many people experience this, and that you should not be ashamed or feel that you should hide these feelings from anybody at all. So I'd just like to say thank you for letting me talk to y'all today, and I hope y'all found it informative.
Molly, hold on.